Today we will examine Porphyromonas gingivalis, a bacterium historically confined to the realm of oral health, but increasingly recognized for its potential systemic implications, particularly in neurodegenerative disease. This bacterium, often overlooked, plays a significant role in gum disease. What's alarming is that its reach extends far beyond our gums. Emerging research suggests a link between P. gingivalis and the growing evidence linking it to Alzheimer's disease. This lecture will explore its biological features, clinical presentations, antimicrobial susceptibility, its role in periodontal disease, and its potential connection to Alzheimer's. The human mouth is a complex ecosystem, hosting a diverse community of microorganisms. While many of these microbes are beneficial, some, like P. gingivalis, can wreak havoc if left unchecked. Understanding this is the first step in protecting ourselves from its far-reaching consequences. Porphyromonas gingivalis is a gram-negative, non-motile, asaccharolytic anaerobe. It colonizes subgingival niches within periodontal pockets, thriving in the low-oxygen environment provided by deep gingival sulci. It derives energy by proteolysis of host proteins, utilizing peptides and heme, rather than fermenting carbohydrates. When cultured on blood agar under anaerobic conditions, it forms distinctive black pigmented colonies due to the accumulation of iron-containing compounds. Microscopically, it appears as short rods and can be visualized using gram staining. Laboratory identification typically involves culture in anaerobic chambers, biochemical assays, most notably for trypsin-like enzymatic activity, and, in advanced settings, PCR amplification of 16S RNA sequences. One of its most significant virulence factors is a family of cysteine proteases known as gingipains. These enzymes degrade immunoglobulins, cytokines, and extracellular matrix proteins, undermining immune clearance and contributing to connective tissue destruction. Another key virulence factor is its ability to form biofilms. These biofilms are like protective shields, making it difficult for antibiotics and host immune system to penetrate and eliminate the bacteria. Although its primary habitat is the oral cavity, P. gingivalis has been detected systemically, raising concerns about its involvement in extraoral diseases. The organism is a key player in the development of chronic periodontitis, a severe form of gum disease. This condition affects millions worldwide, leading to gum inflammation, bone loss, and eventually tooth loss. The initial stages of gum disease, known as gingivitis, are characterized by red swollen gums that bleed easily. The organism has also been associated with cardiovascular pathology, including atherosclerosis, and has been isolated from atheromatous plaques. Implications of P. gingivalis extend far beyond the confines of our mouths. This bacterium can enter the bloodstream through inflamed gum tissues, traveling throughout the body and potentially impacting distant organs. Research has linked P. gingivalis to a range of systemic conditions, including cardiovascular disease, diabetes, rheumatoid arthritis, and even adverse pregnancy outcomes. Evidence is mounting for a mechanistic association between P. gingivalis and Alzheimer's disease. Alzheimer's disease connection. Several investigations have demonstrated that this organism, or at least its virulence factors, can translocate to the brain. In post-mortem analyses of Alzheimer's patients, P. gingivalis DNA and gingipain antigens have been found in the hippocampus and cerebral cortex. While the exact cause of Alzheimer's remains elusive, growing evidence suggests a strong association with P. gingivalis infection. Moreover, gingipains, the destructive enzymes produced by P. gingivalis, have been detected in the amyloid plaques and tau tangles that are hallmarks of Alzheimer's. Mechanism of action affecting the brain tissue according to research. Once in the brain, gingipains appear to promote pathological changes characteristic of Alzheimer's disease. Specifically, they have been shown to induce the production of amyloid beta, a key component of senile plaques, and to facilitate tau hyperphosphorylation, leading to the formation of neurofibrillary tangles. A recent murine study, mice were orally infected with Treponema denticola, another periodontal pathogen. After 24 weeks of infection, these animals exhibited elevated phosphorylated tau at multiple sites, activation of microglia, and increased levels of pro-inflammatory cytokines such as IL-1B and TNF-A within the hippocampus. The broader hypothesis posits that microbial dysbiosis in the oral cavity, particularly involving pathogens like P. gingivalis and T. denticola, can lead to systemic inflammatory states and compromise the integrity of the blood-brain barrier. Combating P. gingivalis and current treatment strategies. In terms of treatment, P. gingivalis is susceptible to several antibiotics, including metronidazole, amoxicillin combined with clavulanic acid, and doxycycline. The latter offers the added benefit of matrix metalloproteinase inhibition, potentially reducing tissue degradation. However, traditional antibiotics have limited efficacy in eradicating subgingival reservoirs. Recently, small molecule inhibitors of gingipains have entered clinical trials, with early data suggesting potential in mitigating neurodegenerative changes. One such agent, COR 388, also known as atuzaginstat, is under investigation for its capacity to reduce gingipain activity in Alzheimer's disease models. Prevention is the first line of defense. Clinicians must recognize the potential implications of periodontal disease beyond local tissue destruction. There is increasing consensus that chronic oral infections may influence systemic health, particularly through sustained inflammatory signaling and microbial dissemination. From a preventive standpoint, maintenance of periodontal health should be viewed as an integral component of systemic disease prevention. Let's test your knowledge. Before concluding, let's reinforce some of the key concepts with a brief quiz. Question 1. What is the Gram reaction and morphology of P. gingivalis? Answer. It is a gram-negative non-modal short rod. Question 2. What are gingipains and what role do they play in disease? Answer. Gingipains are cysteine proteases secreted by P. gingivalis that degrade host proteins and facilitate tissue invasion and immune evasion. Question 3. Which proteins are most closely associated with Alzheimer's pathology and are influenced by P. gingivalis? Answer. Amyloid beta and hyperphosphorylated tau. Question 4. Besides Alzheimer's, name 2 systemic diseases linked to P. gingivalis. Answer. Atherosclerosis and aspiration pneumonia. Question 5. Which diagnostic methods are used to detect P. gingivalis in laboratory settings? Answer. Anaerobic culture, biochemical assays, for example, trypsin-like activity, PCR, and 16S RNA sequencing. Find more questions in the text to test your knowledge. Comment and let us know your experience with this pathogen. Thanks for watching. See you next time.